Hello, I'm Dr. Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is capsular contracture after breast augmentation. What is the definition? The definition of capsular contracture is abnormal scar tissue that distorts the implant. To form a capsule is normal. For instance, once the capsule is formed, the implant should sit and then puddle as a normal implant in the lateral position, so it achieves a teardrop position. When you lay down, it puddles and then flattens out like a normal breast. So what is capsular contracture? Capsular contracture is the abnormal scar that contracts around the breast implant to make it feel hard and firm. I want people, when they touch you, it feels like a normal breast, or they hug you. In contrast to where it bubbles up and feels like a pair of bolt-ons. So why and how does this happen? Let me explain using an analogy of a piece of paper. If you were at a game show and I was the host and you were the contestant, what would we do? We would say to you, what object has the highest surface area to the least volume? That would be a piece of paper. If I flipped it on you and I said, what object has the same volume but least surface area, I'd wad this up like a paper wad. That's what happens with the scar contracture, and it distorts the implant. The incidence varies from 1 to 20%. In my practice, fortunately, it's about 1 to 2%. The causes. Causes can be a low-grade infection, blood that was left during the surgery around the implant, genetics, or biofilm. And let's talk a little bit about what biofilm is. Biofilm is a coat of bacteria that cannot be cultured but is totally adherent to the implant. It was discovered up in the high mountains. A microbiologist went up to the stream, cultured the water coming over the top, it grew nothing. But he then cultured the moss that was growing, and it was full of bacteria. This bacteria is adherent. In the old days when patients had capsules, we would remove the implant, take a culture, remove the capsule, put the implant back in, but it had a relatively high incidence of recapsulization. Therefore, now we go ahead and remove the implant. We use a textured implant. A textured implant has irregularities on its surface, and the analogy would be Lake Powell. A little known fact, Lake Powell is the first lake on the Colorado River below the Grand Canyon. It has more shoreline on it than from Canada to Mexico. Why? All the inlet and jetties. This texturization of the implant provides more surface area, therefore less chance of capsule. The only downside is it velcros in and feels doesn't move quite as naturally. Now the other thing is, if you're in a suprapectoral pocket or subglandular, we'll move it to a subpectoral pocket. Under the muscle decreases the chance of capsular contracture. And then lastly, we add acellular dermal matrix. This is a component that either can be from humans, from porcine, or bovine sources. This is a denatured protein, and it's like a matrix. We put it in, your body then recognizes it as itself and lays down a matrix and prevents the capsule from forming. Now, are there any non-medical things to do? Yes. To prevent the capsular contracture, I'm an advocate of displacement exercises and placing the implant subpectorally. So every time you move your muscles, massaging your implants every morning, every time you go to the bathroom with your bra on, and then every evening you'd massage it around. That way, if you feel that you're starting to get a capsule, you come into the office and we treat you with an zirconia laser that breaks up the scar tissue non-surgically. So how do we prevent it? You go ahead and we use gentle, meticulous technique at the time of surgery, absolute hemostasis. We place it subpectorally and we place it through an inframammary incision. We wash out the pocket with IV antibiotics. We use a no-touch technique. We put a film barrier, change our gloves, and we go ahead and give you oral antibiotics after surgery and IV antibiotics before surgery. And to decrease the decolonization, we have you take 3 days before surgery, a shower in the morning and the evening, and scrub your breasts with Hibiclens, and then coat your nostril, your ear, and your umbilicus with an antibiotic ointment to decolonize your body. With this, we've taken our incidence down to 1%. So, in summary, capsular contracture is a known phenomenon. It has an incidence of 1 to 20%. There are things that we can do to prevent it. Inframammary incision, we place the implant behind the muscle, displacement exercises, the use of antibiotics, no-touch technique, barriers, decolonization. This really lowers the incidence. And then, lastly, it takes follow-up and by the patient to get a understanding of what the breasts feel like. I thank you very much, and should you have any other questions, please don't hesitate to call our office, and I hope to see you soon.